Hello, members of ICRS and all the cartilage enthusiasts from all around the world. We had the fantastic series 1.1 of our Cartilage Visionaries interview, isn't it? We are really pleased to receive many feedbacks and many emails, and people were really happy listening to the lifetime experiences of our cartilage visionaries. The struggle they had, the challenges they faced, the success they had, and the life that they are enjoying. And we are encouraged with that. Today, I'm going to introduce you to two more special people. One is Ilona Uzielienė. She is a senior researcher at Center of Innovative Medicine, Vilnius, Lithuania. And she is the interviewer for today's episode. And I'm also happy to introduce Dr. Dongquan Shi. He is an orthopedic surgeon and senior researcher at Center of Sports Medicine and Adult Reconstructive Surgery at Jiangxing province of China. Both are incredible people, and I welcome both of you. The stage is all yours.
Hello, everyone. It's a great pleasure and huge honor to interview today the Dr. Dongquan Shi. And I will start with something pretty simple. So as you may know, you have been recognized as a leading expert in your region in cartilage repair by ICRS. So how do you feel about that? So what was your first impression when you received the Deepak's email?
First, I think I should thank you so much for the recognition by ICRS. Actually, I just focus on the cartilage research on about 20 years. And I'm so surprised to get an email because I don't think I have so many contributions in this area. But from year 2006, I started my research for OA for some genetic study and found some functional SNPs to try my best to predict the OA occurrence. But after I did find some SNPs, but I found it's very difficult to use in my clinical work and even to delay OA progression. So then I changed my research direction from genetic study to cartilage repair, and I also did some biomaterials like scaffold, a lot of scaffolds. But also I think it is not so close to my clinical work. Then I find a new direction, fibrocartilage, higher lionization, and I try my best to change the cell fate of fibrocartilage into higher cartilage. So that's my the procedure of my research, and I'm so happy to recognized by ICRS as a leader expert in this area. Thank you.
Thank you so much. So let's start from the beginning of your career then. So maybe you could name us a specific moment or event that actually inspired you to go to the cartilage repair and joint preservation.
Actually, I did a lot of surgery for total knee, and I also feel not so happy and feel even depressed. I think we should do my best to make cartilage regeneration, and that's why I try my best to do cartilage repair. Also, I during my clinical work after HTO high tibial osteotomy surgery, I find our cartilage can be regenerated very beautiful. So that's why I put my research most of the time into cartilage repair and regeneration.
But maybe still you can share some highlights or some memorable moments that you really do remember from your career with us.
I think in the past about 20 years, the molecular classification of osteoarthritis and just I referred the fibrocartilage high lionization, maybe 2 milestones for my research work.
Oh, okay. Thank you. So now going deeper into your scientific career and achievements. So we know that you have identified key regulatory factors like SHP2 and TRPV family proteins for molecular mechanisms-based OA treatments. So maybe you can elaborate more on this significant finding and how you can see that in the future of cartilage repair.
Yes, actually, the work you mentioned just right now is based on our molecular classification of osteoarthritis, because for the early stage, maybe the cartilage degradation driving subtype may be the most important part because it's a trigger for OA. So we find new pathologic procedure of OA. We find a cluster of ferroptosis cluster of chondrocytes. And during the procedure, we find a new target of TRP1, and we find maybe it's a new target for OA treatment. And it's very interesting. TRP1 can be activated by the temperature. Maybe we find during our experiment, we found about 42 degrees can activate the TRP1 and can delay the OA progression. So I think that's the most important, interesting part. And the second one, we find another cluster, the reactive regeneration chondrocyte cluster. I find it's like a new seeds for the cartilage regeneration. So during our research, I think new target, and the new treatment, maybe it's a good potential or candidate for OA treatment. But I think if you want to use to my patients, I need still a little long way to go.
Oh yes, so we all know these ways, of course. And another question about your developed special tools for autologous osteochondral transplantation in 2019 and a preparation method for a gel scaffold to repair cartilage. In 2006, I think you developed that. So maybe you could also discuss how these innovations have advanced in the field of cartilage repair and what are their applications in clinical practice.
So compared with the traditional treatment, our hydrogen have very I think our hydrogen have three good parts. First is a liquid hydrogen, because every injury cannot generate a very regular shape of the defect. So liquid hydrogen can fit all shapes of a defect. So I think the most important part. Secondly, because our scaffold can be it's ultraviolet reactive rapidly and cross-linkable hydrogen. So during our surgery, it make it easy to make the hydrogen become hard tissue, and at the place of the defect, it can be release drugs like our drug KGN, and it can be released a long time. About in my experiment, it can be released for 2 months. So it have enough time to regenerate cartilage. And the third part is very important. It's the cost is very low. So I think it's a good potential for future cartilage defect treatment.
So, in speaking about your other activities, I'm very curious about your philanthropic activity like BAI project. So, where you propose to patients, maybe you could comment on that as well.
The BAI project actually means 100 station in the village, because in my outpatient clinic, lots of patients didn't get the right treatment and right knowledge and the right practice for the muscles, and so I feel very sad, because I think I should do more for the patients. So that's why I set up BAI project. I train the trainer. We go to a village to train the doctors in the village and tell them the most important part of how to treat the OA and how to do rehab, how to try find a patient, which patient needs to do surgery, which patient can, be treated by the drugs. So that's why I did the project. I hope can, be closer to my patients and try to, have a direct pathway from the patient in the village and to my group.
Yeah, that's very kind of you. Thank you. Now let's talk about the people that were with you during this whole way. So maybe you can name a few colleagues or mentors who you were significantly influenced by and who really, which really impacted your work.
I think the most important my teacher is Dr. Freddie Fu from University of Pittsburgh, and very sad he passed he passed, and he inspired me a lot in my not only clinical work and some research work, and I still remember he told me first you should do what you love, because if the things you do you loved, you can do the best. And if you hate what you do, you never can do very good. So that's what I think the most important part is do what you love. Then he told me be a dreamer, and if you want to do some innovative work, you have to be a dreamer, or you cannot get a point. And the third part, he told me be closer to your patients, and sometimes you even touch them, and they can feel very warm with you, and the patient can have more trust, to you. And I also in my clinical work and research work, I remember Dr. Freddie's words, and I followed his instructions. So I think he's inspired me a lot, not only in clinical work, also for research.
Thank you. And how about your wife and friends? So I know that you mentioned before that your best friend is a doctor and your wife is an oncologist as well. So what was their role in your work?
Actually, my wife, is my classmate, and we get to know in my college life. So, and we love our work very much, and I think we have very good competition in others area. And if she got some very good prize, I would do my best to get the prize in my area. And also sometimes if someone have depressed, we were to encourage them, and tell it's nothing, we can keep going. So I think my wife and is a good, not only my wife, it's also my good close friends and also good collaborator, I think. My friend, I have lots of friends. I like to make friends very much, and like Dr. Shao, also work for the ICRS. He's my junior, and he also helped me a lot, and I learned a lot from him, and his English is very good, and also he like to do a lot of work for the different society, and it can keep me learning, and keep me to do not only for myself, also I can do a lot of work for the society. I think can be a good how do you say, I will try my best to make the our area can be better. So also I can like to help other young surgeons, not young surgeons, young scientists. I think that's a big part for them, learn from them.
Thank you. So talking about, your surgeon's work and your scientific work, so you're a talented both surgeon and a scientist. So maybe you could share with us, how do you balance these roles in your life?
Actually, I think the most important reason is love, because I love my, my work, love my research work, not and the clinic work, and I love my patients. So I think if you love what you do, I think you never feel, tough. So actually, every week I have 2 outpatient clinic day and 2 operation day. And after my clinical work, all the time is for research. I like to communicate with my students and my co-PIs. We talk a lot about the research area and what in my daily clinical work. I think some confused me. I would tell them, and we have tried to find some research strategy to get the question for the confusion. So do everything. I think very happy, and that's why I think we can do not only for clinical work and basic research.
Yes, I can totally agree with that. And well, talking about your work as a surgeon, so maybe you could share with us what was your first case study? And the second one, well, maybe you can share a particularly successful case study in your whole career, well, related to patients and their highlights, their stories.
I think for my clinical work for the cartilage repair, I think the most happy time is I can make my athletes or some sportsmen can go back to the sports activity. I think that's the important part. So I did some cartilage repair like massage technique for talus and for some knee cartilage defect. And after the 3 months follow up, and they feel so happy. They told me they can have some activities during their training. So I think for me the biggest part, happiest time maybe they actually come back to my outpatient and they show me the video. They can run faster and play better. I think that's the happiest time.
Yes, I can imagine. So, and how do you actually stay updated with the latest developments and innovations in the field of cartilage repair?
I think read more. Every morning, every morning I arrive at my hospital at 7 o'clock. So before the surgery, I have 1 hour to read the daily, very new literatures, the new techniques, new publications, and I think read more is very important. Secondly, I think communication is very important. I like to communicate with my friends, and we have a society, also very small group for cartilage repair in China. So we have a WeChat group like WhatsApp, and if we want some new very good technique, we will share together. So and the third one is, I think, the very important part of joining the international society like ICRS is very important. And we have the leading experts. We have senior scientists. They can show us very advanced technology, advanced publication, advanced knowledge. So I think that's my key for the advanced knowledge.
Okay, and maybe you can discuss any ongoing research projects or clinical trials that you're currently involved in.
In current stage, all my interest is for the upgrade my classification. Actually, the first version 1 for a molecular classification of osteoarthritis is not so detailed. Like other disease, like some cancer, maybe 3 million people, they have maybe over 20 classifications. But for osteoarthritis, we have almost one in China. I think we have 130 million patients. But in the past we only use the care scoring system. I think it's too simple for so huge patients. So that's why we developed a new molecular classification. But we find some problems. We need to more detailed to classify our patients. So the first important area is I want to upgrade the classification. Second one, I try my best to make, I said the cartilage hyalinization, because we want to, change the cell fate of the fibrocartilage, and it will be easier, for clinical use, because we develop a lot of scaffolds. Actually, it's very difficult for clinical translation, but if we can make fibrocartilage into hyaline cartilage, it will be easier. So that's two major, projects in maybe next 5 or 10 years.
Yes, I can agree with that, definitely. What advice would you give to young generation, young researchers and clinicians, and entering the field of cartilage repair? Maybe you can give them some advice.
I think first, like my teacher told me, love what you do, love to cut your repair. I think it's very important. Then you can have a lot of energy and a lot of passion to try to develop new techniques or some knowledges. So first one, we need to love what you do, and the third one, I think we should read more. We should read almost all the publication about the cartilage repair. Every week, for me, maybe every week I will read around 50 publications to have the most new knowledge of cartilage repair. I also want to know the groups in all over the world, what they do. So I think publication may be the very direct, strategy to get the knowledge. And secondly, I think we should observe more. We should observe our patients, observe our images, and observe what we see in the surgery, and we should think. After we find some confused problems, we need to think, and we should make some strategy to find the answers for the question. And the fourth part, I think we should have more communication with in the same city or different city or different country, like join ICRS. I think last year my group went to Barcelona. Even we have very bad flight experience, but we finally get to the meeting, and we learned a lot. So I think join a very leading society and with a lot of leading experts to communicate with, and I think it's very important. Sometimes I know when I was a young researcher, I know we sometimes for the cost is very big problem to join the international society. I think if you try your best and get more fundings, I think we have a strategy to solve such kind of problems. So first of all, what do you do? And read more, observe more, and join community.
Thank you so much, Dr. Shi. It was a wonderful interview. Really hope to follow more of your findings and in the future, and keep in touch.
Thank you. I'm so happy to communicate with you, and I learn a lot.
Thank you.
Wow. Love what you do and do what you love. Very inspiring, isn't it? With this interview series, we are gradually learning that there are people sitting in far corners of the world who are very enthusiastic, very passionate, and they are learning and they are doing great work. They are doing hard work to gain knowledge, to improve on their skills, and thereby to improve their professional lives. And not only they are improving their professional lives, but they are making difference to the lives of people around them and the society at large. We are really thankful to these people. Hard work these people do. They do strategy planning, they do social work, they do change in the classification system, they try to improvise new strategies to treat cartilage lesions, but all are actually real heroes of cartilage world. And they are helping in the battle to preserve the joints, isn't it? Friends, every month we are going to bring one interview to you. The next interview will be in the first week of September 2024. And do you know who will be the interviewee and interviewer? Keep guessing. I'm not going to tell you. Thank you very much.
Thank you.
Thank you.